Hello, everyone. Welcome to today's webinar on healthy housing. My name is Nicole Bronson. I'm a Senior Communications Officer here at the Robert Wood Johnson Foundation. As many of you know, this is the second in a series of webinars in partnership with the New Jersey Health Initiatives to help our partners in our home state connect, collaborate, and share emerging ideas and best practices. So we hope you're going to find this webinar informative, engaging, and inspiring as we reflect on the role that housing plays in achieving a culture of health. With that, I'll turn it over to Diane Hagerman, the Deputy Director of Programs at New Jersey Health Initiatives, who will be the host and moderator of today's presentation. Diane?
Thank you, Nicole. As so many of you already know, when it comes to health, so much depends on the basic conditions where we live. Things like access to affordable, stable housing, reliable transportation, parks and green spaces, clean water, and even broadband services. And these conditions make a difference in our opportunities to get a quality education, a job that can support a family, and to connect with others. These basic conditions set us up for success and, in turn, influence our chances of being healthy. Today, we're here to talk about how we can work together as communities and as a state to make sure that the homes where people live across New Jersey provide a safe, affordable environment, necessary for us to actualize a culture of health where everyone has the chance to live life to the fullest. Before we begin, I want to address a few housekeeping items. I'll talk just a bit about NJHI in a minute, but I encourage you to visit our website, njhi.org, for more information on how we work with our partners. Also, please be sure to visit rwjf.org for more information on the important work the Foundation is doing to help people live in healthy physical environments, not only in its home state of New Jersey, but across the country. We want you to get used to the Webinado platform that we're using today. The platform consists of two parts: the viewer window, found on the right side of your screen, and the control panel, which is on the left side. We welcome your questions, so please be sure to type them into the question box found in the control panel throughout today's conversation. The questions will only be seen by me and will be addressed during the live Q&A with our panelists at the end of our discussion. At New Jersey Health Initiatives, the statewide grant-making program of the Robert Wood Johnson Foundation, we work with communities across the Garden State to make them the healthiest they can be, free from economic and social obstacles that stand in the way of advancing health and health equity, all with the goal of building a culture of health statewide. At the center of that work are community partnerships that cut across sectors. Different voices from different backgrounds sit at the same table to share resources and collaborate on addressing social determinants of health. Housing is perhaps the most well-researched social determinant of health, and the links between housing stability, affordability, safety, and health are strong and compelling. A growing body of research shows that housing interventions, including improvements to neighborhood conditions, improve health outcomes, and lower healthcare costs. Our grantee partners are showing us the value of bringing multiple voices to the table to talk about the impact our homes and neighborhood conditions have on the health of our communities, its residents, and our state. We know that where we live matters to our health. Here are some examples. Homes provide families with stability, work stability for parents, and stability at school for kids, and a sense of being able to plan beyond tomorrow. Housing instability creates disruption and anxiety for families and their children. Unstable housing can result in disruptions to employment, social networks, education, and access to or consistent receipt of social and healthcare services. Housing costs determine the resources that families can spend on important things like healthcare, food, and transportation. And predictable housing costs are essential to financial planning. Equity in a home can be used to build a nest egg for a child's education or for other opportunities that are important to their future, transferring wealth between generations. A house is more than a home. It determines the neighborhood we live in and all the opportunities and barriers associated. Housing in neighborhoods with safe places to play and exercise, grocery stores with healthy food, and availability of good jobs with fair pay create opportunities for better health and well-being. Reliable housing protects us from extreme weather conditions, disease, and injury. The healthcare sector, businesses, community-based organizations, foundations, and government each have unique roles to play in ensuring access to safe, affordable housing. And that's why we're here today to talk about it. So we're joined today by three people who work hard to make sure that residents across New Jersey are living in healthy, safe, affordable, quality homes that in turn boost the quality of their lives overall. I'd like to introduce our three panelists today. First, we have Manny Castañeda, who is the Director of Community Health at New Brunswick Tomorrow. Manny joined New Brunswick Tomorrow in 2015 and handles the management and implementation of health and social initiatives of Healthier New Brunswick, a collaborative approach designed to unify, promote, and encourage participation in community efforts that foster a culture of health and wellness. Stephanie Greenwood is a program officer at the Victoria Foundation. Victoria Foundation is a private grant-making institution with targeted giving to programs that impact the cycle of poverty in Newark, New Jersey. Within Newark, some of their funded projects address K-12 education reform, neighborhood revitalization, and strengthening youth and families. And Debby Goldberg is Vice President of Housing Policy and Special Projects at the National Fair Housing Alliance. Debby works to ensure that federal housing policy effectively addresses the needs and rights of people of color, families with children, people with disabilities, and others protected under our nation's fair housing laws. Before we dive into our discussion with our panelists, let's take a quick poll of you, our audience, to find out what you feel the biggest challenge is to achieving healthy housing in your community. So please take a moment to participate in the poll on your screen, and then once you vote, you can close the poll and we'll revisit the question and the answers at the end of our presentation. So I think that's enough time. We'll give a few more seconds for people to answer the poll. So as most of you know, 2018 marks the 50th anniversary of the Fair Housing Act. Before we talk to our panelists about how far we've come over the last 50 years and how far we still need to go, I wanted to briefly explain how we got here. According to the National Fair Housing Alliance, housing and residential segregation made other forms of segregation like financial and education easier to achieve. This is why civil rights leaders like Dr. Martin Luther King Jr. worked to combat housing inequalities. 7 days after Dr. King's assassination, the Fair Housing Act was signed into law by President Johnson. While we've made strides to close gaps across our nation, these gaps still exist. I think we're all looking forward to today's discussion to hear from our panelists as to how they've closed gaps thus far, and we look for a lively discussion about how we can work together to continue to close those gaps. So I'm now happy to turn it over to Debby. So Debby, from a national perspective, Can you please describe where we are in relation to 50 years ago when the Fair Housing Act was created?
Thanks, Diane. And I want to thank New Jersey Health Initiative and Robert Wood Johnson Foundation for inviting me to be part of this webinar today. You know, there's something about a 50th anniversary of anything, the Fair Housing Act included, that makes us want to go back and look at what happened 50 years ago, what were things like then, you know, and how does that compare to what things look like now. So directly in line with the question that you just asked. And while the Fair Housing Act was passed 50 years ago, to answer that question, I'd like to just go back 51 years to July 12, 1967, when police in Newark arrested an African-American cab driver named John Smith for a number of alleged offenses. In the process of that arrest, they beat him up pretty badly, and rumors began to circulate around the community that he'd actually been killed, which was not true, but obviously alarmed people. So that evening, people went down to the 4th Precinct Police Station for what was intended as a nonviolent protest, but erupted into violence. And that violence continued for 6 nights. During that time, the National Guard was called in. 26 people died, 750 others were injured, 1,000 people were jailed, and there was an estimated $10 million in property damage. But Newark was just one of 150 places around the country where people in the African-American community took to the streets in protest that summer. And as in Newark, in many other cases, the protests were sparked by something the police did, but they were fueled by people's anger and frustration over many other things. For many decades, both the private sector and government at the local, state, and federal levels enacted and followed policies and practices that deliberately separated people by race and national origin. And so the result was that African Americans and other people of color had very few choices about where they could live. And in the segregated communities, housing was limited, it was often in poor condition, and it was overpriced. And as you suggested earlier, that segregation in turn severely constrained the opportunities available to people in terms of schools, jobs, transportation, access to healthy food, recreation, and many other things. And by the summer of 1967, people were just fed up. So it was against this backdrop of racial unrest and a heightened awareness of racial inequality, Congress was forced to take some action. And in 1968, 1 week after the assassination of Martin Luther King, Congress passed the Fair Housing Act. So I think most of us know that the Act prohibits discrimination in housing based on the 7 characteristics that were listed on the earlier slide. But it has another purpose as well, which is to end segregation and ensure that HUD and other federal agencies take affirmative steps to overcome the harm that it caused. So that part of the Act is known as the Affirmatively Furthering Fair Housing, or AFFH provision. And with that provision, Congress was acknowledging that the federal government, among others, had played a role in creating racial segregation, a system that was designed deliberately to isolate and disadvantage people and communities of color. It was a system in which your zip code really did, and to a large degree still really does, determine your destiny. And given that history, it was not enough in 1968 simply to declare an end to discrimination and assume that we had achieved equity. Rather, Congress wanted HUD and its grantees to take deliberate steps to create more equitable communities. And doing that means both reinvesting in neighborhoods that we have long disinvested from so that they offer their residents the full range of assets and resources that they need to flourish, and also creating more affordable housing opportunities in communities that already have good jobs, good schools, transportation, access to healthy food, et cetera. You could think of those two things as the twin goals of AFFH. HUD largely ignored its AFFH obligation for 47 years, but in 2015, it put out a new regulation to implement this part of the Fair Housing Act. The regulation gives us a definition of AFFH that includes taking meaningful action to create diverse, inclusive communities free from barriers to opportunity based on protected characteristics. And at the heart of that regulation is a requirement for HUD's grantees to create a fair housing plan for their jurisdictions. It's called an assessment of fair housing, and it has a number of notable features. First, it creates a seat at the table for community-based organizations, including those that provide health, housing, and social services, as well as those representing members of protected classes. Second, it provides an opportunity for the community to come forward with important data and knowledge to be incorporated into this fair housing planning process, which could include, and in some cases has included, information on the health impacts of housing. And the priorities and the goals and the strategies that are identified in the Fair Housing Plan then have to be reflected in the jurisdiction's spending plan, what's called its consolidated plan, so that the two plans are aligned. And finally, the rule requires jurisdictions to take meaningful action to implement those plans and prohibits them from taking actions that are materially inconsistent with their AFFH obligation. This was a major step forward, this rule, and the early results of the new process have been very promising. One that I would just note, for example, is New Orleans, which, among others, adopted a goal of creating equitable, healthy housing that recognizes the direct connections between healthy housing and quality of life. That's a direct quote, actually, from their assessment of fair housing. But unfortunately, in January of this year, HUD hit the pause button on this regulation, and it sent jurisdictions back to an old process that was widely considered to be ineffective, even by HUD itself. So that matter is currently in litigation. More recently, HUD issued an advance notice of proposed rulemaking on the AFFH rule, which suggests that it may be thinking about going back to the drawing board and starting all over again. We think that would be unwise, and I would encourage all of you to weigh in with HUD and to submit comments by the October 16th deadline. But while HUD is pondering its next steps in this area, we all can still take advantage of this rule. Jurisdictions still have to do a fair housing plan, and there's nothing to prevent them from following the format and the process set out in the 2015 rule. And in fact, a number of jurisdictions have decided to do that because they think the process just makes a lot of sense and will lead to better outcomes. And right now we are at a critical point in time as jurisdictions are trying to figure out what to do. There are 52 jurisdictions in New Jersey that will be doing their consolidated plans, their spending plans, by the end of 2020, which means that those same 52 jurisdictions should be doing their fair housing plans between now and the end of 2019. And this is a perfect opportunity to engage with them and ensure that they understand the connections between health and housing and that they're strategic about addressing both. So just to wrap up, when I look back at the events 50 years ago that prompted Congress to pass the Fair Housing Act, I think that what we knew then, but seem to have forgotten now, is how the government took deliberate actions to help create a segregated society, one that's separate and unequal. But what we didn't know then, and are coming to understand now, is the many ways in which segregation and all that flows from it, including disinvested communities, concentrated poverty, physical, emotional, and psychological stress, how all of that has a big impact on people's health. And I think that's the conversation that's going on, right, in the public health world about the social determinants of health. And it closely tracks the conversation that's going on in the fair housing world about affirmatively furthering fair housing. And so I would hope that we can find ways to bring these two worlds together and to have a single conversation about these issues. And I think that the AFFH rule may be one vehicle for making that happen. Thank you.
Thank you, Debbie. And I just want to remind our participants to submit your questions if you have them throughout using the chat box on the left side of your screen. So now I'll turn it over to Stephanie. Stephanie, if you could tell us about the work of Believe in a Healthy Newark and their Healthy Homes Impact Team, and maybe talk about 2 or 3 of the biggest challenges you're trying to overcome and what you've learned that could help people in other communities dealing with these issues.
Sure, and thank you so much for the invitation to participate in this webinar. I really appreciate the context that Debbie just shared. Many of the conditions that led people to rebel in Newark in 1967, including housing that I think she said is limited, in poor condition, and overpriced, are all very much in evidence in a lot of the neighborhoods where we and our grantees work. And this 50th anniversary seems like a very good time to reflect on how serious that is and recommit to trying to shift those conditions. And the nexus between health and housing, I think for a lot of us working on this issue, has seemed like a powerful entry point to push in that direction of making that shift. So Believe in a Healthy Newark works to achieve better health outcomes for children in Newark's South and West wards, 2 neighborhoods in particular in those wards, using a collective impact approach. So we're working to change policies and practices, bringing people together across types of organization, types of practice, to come up with and then move together toward common goals in 3 key areas: food and fitness, healthy homes, and adverse childhood experiences or trauma. All 3 we know really affect life outcomes for children later in their lives, and all 3 teams come together once a year for an annual conference to share the work that they've been doing. I'll just put in a minor plug that our conference is next week for anyone who feels like learning more about this work in person. It's the 27th. I co-chair the Healthy Homes Impact Team, and our focus is on reducing harm to children, particularly from lead poisoning and exposure to asthma triggers in their homes. Our group includes researchers, healthcare providers, nonprofits that do weatherization and lead remediation, advocates, city staff, funders such as Victoria Foundation, and technical assistance providers. We've focused in the last year and a half roughly on conducting focus groups to measure community knowledge about both the risks to conditions in homes and knowledge about available services. And it turns out that people actually tended to have a high level of awareness about risks and a very low level of knowledge about available services, which was something interesting for us. We're also doing our best to create a house-by-house map of exposure in our 2 neighborhoods, really going very micro to try to learn as much as we can about where these exposures are coming from and to create a better basis for an advocacy campaign that pushes for stronger regulation to improve the conditions of the homes. The focus really is on a shift to preventative approach, so we're looking to improve conditions in homes as opposed to a reactive approach of waiting, for example, until a child is lead poisoned and then coming in and taking action. So this is an attempt to bring together all the people who touch housing to work on that move toward a preventative approach. This means bringing together healthcare providers, schools, city agencies, community groups, and others to integrate service delivery in the target neighborhoods. So I'll just mention a couple of challenges. There's a basic challenge of building trust, both among providers and with the residents. Doing this preventative approach means going into someone's house before anyone thinks there's a problem. And so that really involves being in someone's personal space. This is hard anywhere. It's particularly hard in neighborhoods that have been targeted by predatory practices and where crime and public safety are big concerns. So one of the ways we've tried to respond to that is by hiring and training community residents to serve as outreach staff on behalf of nonprofit partners. I know this is something that also happens in New Brunswick. I'm looking forward to hearing from Manny about his work there. Our residents went through a training by Isles, and they were equipped with a lead detection spray as well as some basic cleaning materials and information for families about how to keep children safer and how to access services for a more permanent solution to the problems in the homes. The uptake jumped dramatically using the residents as outreach workers, and although I will say there were definitely some lessons learned along the way about what is needed to better support residents who haven't done this type of work with nonprofits before. We've also had to work hard to build trust within our team and push ourselves to change business practices so that we can be more collaborative. We've had to figure out ways to data share in ways that don't violate HIPAA protections. We've worked to try to find ways to integrate the results of our focus group learnings into our practices and to make it easier for residents to access multiple services without overly burdening their time. We're also working together on strategies for enhancing enforcement, especially in rental housing, without overwhelming the capacity of our city government, which is strained, or creating any unintended consequences for residents, which is a very serious issue that we face because most of our residents face quite limited housing options and have relatively low bargaining power with their landlords. We've struggled, speaking of landlords, to get permission from property owners to make even free repairs. In Newark, about 73% of residents rent. It's really a renter city, and landlords are often reluctant to sign up for programs even when they are free. And of course, as was alluded to earlier, there's this bigger picture challenge of poverty and the lack of bargaining power that comes with it. And I think for us that points to a need to integrate healthy housing work with other efforts. For example, efforts that deal with access to living wage work and advocacy for increased investment in other social determinants of health in urban infrastructure and urban institutions. So I'll stop there. I look forward to the question and answer. Thank you.
Thank you, Stephanie. Now I'll turn it over to Manny. And Manny, New Brunswick Tomorrow has been a champion for social and economic revitalization since the mid-'70s. New Brunswick is also a Build Health Challenge community, which for those of you who don't know, that is a national network of grantees working on social determinants of health. And New Brunswick Tomorrow plays a leading role in that collaborative. So Manny, if you could tell us about your the partnerships you've developed in your work, what you feel are the best strategies for getting people to work together in this area, and then as Stephanie mentioned, if you could talk about how working with the ambassadors in New Brunswick has improved communications with residents.
Sure, thank you, Diane, and thank you to New Jersey Health Initiatives and the Robert Wood Johnson Foundation for this opportunity to share the work that we do here in New Brunswick. So as you mentioned, New Brunswick Tomorrow has been around for quite some time here in the city with our main mission of really to improve the quality of life for New Brunswick residents. We do that by serving as the main convener of stakeholders and as a bridge to the community so that the community has a voice in addressing the needs of the community and then creating ideas, partnerships, and then moving to initiatives that help move New Brunswick's people forward. So for us, the Build initiative was a great opportunity to extend a lot of the work that we've been doing through a larger network called Healthier New Brunswick. So much like Newark and believe in a healthy Newark, Healthier New Brunswick is a group of organizations and stakeholders, private, public, community-based, faith-based, all that came together around the mission of improving health and healthcare in the city of New Brunswick for its residents. I'd like to say that we were practicing collective impact before collective impact became a term, and it is one of the reasons that I think that we have success in working together. You know, we've come together around a shared vision. We've established shared measurement. New Brunswick Tomorrow commissions a community survey here in the city of New Brunswick every 4 years to really help identify the relevant needs of the community. And that's one of the major data points that we use in order to really address the issue and move our work forward as a collective. We reinforce our activities, so we're really intentional about making sure that we're leading where we need to lead with respective organizations, and we're supporting respective organizations not to duplicate efforts. And we're always about, making sure that we're always in the loop with what we're all doing. So we have our communications campaign, Live Well, We Be in New Brunswick, that really serves as a way to not only inform the partnership, but also inform the community about the initiatives that are happening. So with us, we created a subset for the Build called the New Brunswick Healthy Homes Collaborative, which basically focuses on healthy housing. The reason that we focused on healthy housing was twofold. As Healthier New Brunswick, through the foundation, did our Blueprint for Action, or our strategic plan around healthcare, we recognized that social determinants were important to focus with respect to really improving health overall and creating a culture of health. Healthy housing was one of the major areas that we identified. Likewise, the two hospital systems in town, St. Peter's University Hospital and Robert Wood Johnson University Hospital, have their CHIP, which is their community health improvement plan that they have to do that also identified healthy housing as an important focus. So there was a natural synergy, if you will, for us to focus on healthy housing, and that's how we ended up using the Build Challenge to focus on healthy housing. So through our extensive work, what we wanted to do was to look and see what the relevant issues are with respect to healthy housing in the city. We hedged or leveraged on the fact that we have old housing stock, that we have significant numbers of children going into ER visits based on asthma, as these being major issues resulting from their home environment. But we didn't want to be prescriptive, so we didn't want to say that these were the actual issues. We wanted to make sure that we had the community on board to really tell us what they felt were the relevant issues. With that in mind, we held community forums where we really just asked the questions. Although we were hedging on these things, we were always open and adaptable to really focusing on the healthy housing issues that the community wanted to focus on. Another thing that we created here in New Brunswick was we actually leveraged our Community Health Ambassador Corps. So this is a group of community members that are trained on outreach and on specific health areas that go out to do real peer-to-peer intervention to really get at the issue, to be able to effectively reach the community and get buy-in. So I think an important example is, with respects to our healthy housing work, prior to the ambassadors, joining us and starting the work, we had about 12 referrals. So let me backtrack a little to say that our program is about going into homes, assessing the homes for conditions that can affect health, and then helping residents mitigate those issues with available resources. And so that's the role that our ambassadors take after they've been trained to really go into the homes. So within the time that they actually started going out there and doing community outreach to let people know about healthy housing, where we only had about 12 referrals, within one community event, they had 90 people sign up. So it really speaks to the effectiveness of these peer-to-peer interactions, especially in New Brunswick, where we're dealing with a lot of barriers. We have a significant marginalized population, mainly of Latino origin, that have unfortunately had to deal with a lot of immigration anxiety due to the changes in immigration and ICE activity, and the increase of ICE activity here in the city. So we were afraid, or were cautious, and understood that we probably weren't going to get into people's homes as much as we wanted to. But the ambassadors have really met to that challenge and moved forward. The ambassadors were lucky enough to focus on, we're focusing on two areas of New Brunswick specifically, the Unity Square and Esperanza neighborhoods. Really because of, this is where we've identified where the most of the social and health disparities, where residents rather are experiencing the most health and social disparities in the city. And we're lucky enough to have two neighborhood projects that are already working to develop not only the infrastructure in the neighborhood, but also the neighborhood residents themselves as leaders and advocates of the neighborhood. So we really leveraged them, the Esperanza neighborhood being under New Brunswick Tomorrow, to identify leaders to really join our program and make it the success that it is. Thank you.
Thank you, Manny. So before we turn it over to our questions from the audience, and I want to give one more reminder, if you have a question, please type it into the chat box on the left side of your screen. Let's revisit the results of the poll question. So we asked all of you, what is the biggest challenge to achieving healthy housing? And the responses were 58% of the audience selected structural challenges, including poverty, racism, legal barriers, lack of tenant bargaining power. 37% selected lack of financial resources. 12% selected lack of understanding of the connection between housing and good health. And 8% selected lack of community trust. So I want to turn it over to our panelists. Just looking at those results to the poll, does that surprise you? Is that kind of what you expected to see, or do you have any comments to the responses or suggestions about this poll question?
So this is Manny. I guess I'll start. This is not surprising. I mean, within the work that we're doing around healthy housing, although I initially said that we were looking at lead and asthma to be our major issues, what we've come to find out is that, it's really legal barriers, tenant-landlord issues where, landlords are not making necessary repairs. Important to note that New Brunswick is a heavily absentee landlord, city, so there's more landlords not living in their homes that they're renting. And we really had to learn to create relationships with non-traditional partners like the City of New Brunswick's Rent Control Board and the housing inspectors to see how we can help best mitigate those issues and create systems that will help support the healthy housing overall.
And I'll echo that. This is Stephanie. I think the structural challenges being the top result really speaks to how entrenched and difficult these problems are and why we are 50 years later still facing many of the same conditions. And I think we've had to really appreciate what the alternate options for housing are and are not for the residents that we're hoping to serve. And that's led to some conversations about how we can work together to try to generate a greater supply of quality, affordable housing. We have really a pretty high level of awareness among our residents that they're living in unhealthy conditions, that the conditions are affecting their children, but many of them feel they don't have a better place to go.
And this is Debbie. I would just add that I find it very heartening, if that's a word, that so many people did hone in on that fourth option, the structural challenges, because I think, it's just a good reminder, and it's glad to see that people, are seeing the connections, right? All of these structures that we set up in our society that were intended really to keep us apart and to disadvantage certain neighborhoods, and that we've got to dismantle those and replace them with structures that are more equitable and will lead to more equitable outcomes for people, because our communities and our country really depends on, each of us being able to live to our fullest potential, right? If we're going to be prosperous in the future, we really need to be working towards that end. And so I think it's really great to see people thinking about kind of these structural issues and not just focused on the more kind of granular house by house or person by person kind of solutions. As important as those are, if we can make some of these big structural changes, I think we can, it'll be easier to do that person by person and house by house kind of to create those changes, and we'll get farther faster, I think, if we can tackle some of these structural issues.
Thank you. Thanks. So, what to make healthy housing a reality in New Jersey, and I'm throwing this out to, I'm not going to call on any one of the panelists and put you on the spot, but to all three of you, feel free to answer. What key elements do we need to succeed to have healthy housing in New Jersey?
This is Stephanie again. I am echoing Manny's point about legal representation being one of our key elements. If we had better availability of legal representation for tenants, their bargaining power would be stronger across the board. And I think that would help in all of these efforts.
Yeah, this is Manny. I would go just a little higher level to say that, in order to make healthy housing reality, you have to have a cultural shift around healthy housing, and that's both looking at system and policy changes that'll support healthy housing. And, that's really the end outcome that the Bill grant really wants to push forward. And we definitely wholeheartedly agree with that kind of, thinking where it's about getting the buy-in from the community. It's about looking at, non-traditional partners like the city to really make sure that there is an emphasis on healthy housing moving forward.
And so this is Debbie. I would add two things. I think first that it's important to think about the different sectors or silos that have an impact on healthy housing. So in addition to some of the more obvious ones, right, the health department, the housing department, thinking about things like transportation, both in terms of like where are highways or other kinds of facilities that may be causing pollution, but also, you know, who has access to the transportation that they need in a form that's, you know, dependable and affordable in order to be able to get to jobs or school or wherever they want to go. So thinking about, you know, that and other sectors and ways to bring them into the conversation, which at the risk of beating a dead horse here is what this, you know, fair housing, this affirmatively furthering fair housing process is intended to do, recognizing not only the intersection of all of these issues and, you know, the impact of where we live on our access to all of these kinds of resources, but also the limited money and other resources that any jurisdiction has to deal with these issues. So the need to be strategic and look to be leveraging your different streams of funding, whether that's transportation or health or environment or housing or whatever, you know, so that you're getting the biggest bang for your buck. I would just note on the legal representation point that in Philadelphia, which not too long ago went through its assessment of fair housing process, one of the issues that people in the community identified was the rising number of evictions and the rarity to have a tenant be represented in court to defend against being evicted. And so one of the outcomes of that planning process was that the city actually created a new program and set aside money to fund legal services attorneys to represent tenants who were facing eviction, you know, which, as I said, in the past was a pretty rare occurrence for them to have a lawyer in court with them. So, you know, this process could potentially be a vehicle for getting legal representation for evictions or other kinds of issues that tenants may have with their landlords, if that's a factor that people in the community identify as an important one.
I just like to add just a little bit onto that is that what we've noticed here with respect to legal representation is the fact that even legal services can't help us because we have a significant number of undocumented that don't have access to legal services. So we're looking at other ways to be able to provide at least some legal representation for this group of people that don't have access in one way or another. One of the things that we were trying to do is actually try to bring down the HEAL program from the Rutgers Law School down here. I know that they're in Newark, but trying to bring them down to New Brunswick to see that whether they will focus on tenant-landlord issues.
Thank you. Thanks. That was a good example, Debbie. And yeah, Manny, talking about the medical legal partnership in Newark is an interesting concept. You've all touched on, you know, the intersection of the issues and the multiple partners that it takes. Manny, you've even mentioned a couple times non-traditional partners. And we know the importance of healthy housing and that it's so much more than just a physically safe space. But what challenges have you faced in educating others that lack this awareness around healthy housing and its impacts, or in engaging partners that really need to be there? Or are there challenges?
So I guess I'll start. I think I look at it as a twofold question in sense of one is the challenge of reaching the community and really having the community understand that housing conditions can affect their health in the long term, especially here in New Brunswick where the demand for housing is higher than the supply. We compete here with Rutgers University and a lot of students that look for off-campus housing, which keep our rents relatively high, which leads to overcrowding. So the fact that, you know, families are dealing with the basic necessities in terms of shelter, food, you know, to talk to them about healthy housing and, you know, and their housing conditions, and to really make them understand that this can affect their housing, their health, their family's health, is one challenge. The other one on an organizational level is, you know, looking for those non-traditional or identifying those non-traditional partners that are really important. So like I mentioned, you know, and I'll keep mentioning the importance of the city and making sure that there's enforcement of health, you know, of housing code to really push and promote healthy housing overall. And just being open to the as experiences come, as you start getting information, looking for those partners that are needed. We've been lucky that we've actually even partnered with the Red Cross to do, and they're providing now smoke detectors in the home. So they've been going in with our ambassadors to do that. So I think the challenge is to be open, to really allow that, as you get information, to really expand the horizons in terms of the partnerships that are really needed.
I'll add, this is Stephanie, that we have been working, I think, with some success to try to engage education funders in this work, working with them to help them understand that some educational outcomes do really hinge on children showing up healthy, and early investments in home health can be a big lever there, especially preventing lead poisoning, obviously, but as well with asthma being a leading cause of absenteeism in the district. That we see a real potential nexus there with improved attendance related to improved health. So that's something I think we hope to grow in the future.
So this is Debbie. I would just add, thinking from the perspective of our members who are individual, local, private, nonprofit fair housing groups around the country, including, I should say, 2 in New Jersey, the Fair Housing Council of Northern New Jersey and Fair Share Housing, are 2 members in New Jersey, that I think what folks have found really important to do, in part when you're reaching out to what Manny has described as those non-traditional partners, is to really twofold, I guess. One is to make sure that you're sort of translating, the information that you have and the issues that you're working on into language that is accessible to people who aren't necessarily in the same field, because we all have jargon, right, in our fields, and I think we tend to sometimes forget when we're using that jargon because it's so second nature to us. So making sure that we're talking about stuff in ways that other people can really understand. And then the other is taking a little bit of time to understand what your potential partners are working on and to try and identify the points of connection and intersection between your work and their work, so that it's clear on both sides what the advantages would be of working together, to both organizations. So this is thinking on an organization to organizational level. And I think, in the fair housing planning context, our members have found that if you do that, if you kind of try and figure out where organizations are and what they're working on and how that connects, and help them understand and see that connection, that is, it's a lot easier to get engagement. And also can help you kind of expand what you do, because it can help you understand how what they're working on, might be helpful to your organization.
Thanks, Debbie. So following up on that, what about any of you, what have you learned, as Debbie talked a lot about the organizational level, but how about engaging people at the community level in these kinds of conversations? And how have those connections and the connections with other organizations really helped you advance your work?
So this is Manny. I think I pretty much mentioned that. Our community health ambassadors really are the main reason for the success that we've been having in terms of engaging the community. And I would say that you want to go beyond engagement. I mean, engaging the community is great, but we need to evolve to, having community participation, where the community is involved from development through implementation of a project, if you really want it to effectively resonate within community overall.
Yeah, thank you, Manny.
I would say being embedded in community is really important, so that we have multiple efforts that a lot of the people who are active in the Healthy Homes campaign also where they also participate, and so I think building relationships that are reciprocal with community groups across multiple issues is very helpful for gaining trust and developing that reciprocity that allows for work that is so personal to go forward.
Yeah, that's important. I think we've learned that at New Jersey Health Initiatives with the work of our grantees is that trust both at the community level is vital and at the organizational level. It's, individuals have to feel that confidence in each other to be able to move this work forward and really understand what their role is and that they will all benefit from working together on this. So thank you. So if I could ask each of you, what is one piece of advice you'd give an organization that's just getting started? Or if you had to start your work all over again, what would you do differently?
All right, this is Manny. I guess I'll start, and I'm just gonna, kind of piggyback on my recent, comment. And really, the one piece of advice I can give is to really emphasize community participation. Make sure the community leaders of the community are there to really provide insight, feedback as a way to bring in the community and make sure that your initiative is relevant.
I would echo that. I think starting with a lot of conversation with people who are directly experiencing the conditions that you're hoping to shift is invaluable. So I think maybe looking back, we would have done more focus groups or done them earlier, spent more time as sort of flies on the wall with some of our early childhood centers and places that serve families that might be affected by the housing issues that we're concerned with. I think the more exposure we have to those conversations, the more informed and the more effective our responses can be.
And this is Debbie. I guess I would add that I would encourage groups to reach out to their local fair housing partners, the fair housing organizations. In addition to this fair housing planning process that I think fair housing groups can be helpful in kind of bringing other folks into, that there are other ways in which the Fair Housing Act potentially can be a tool in addressing some of these problems. And one I'll just mention real quickly, we at the national level, along with a lot of our partners our members around the country, over the last, I think it's like 8 years now, it's a long time, we have been looking at one particular issue that I think really intersects with questions of health and housing, and that's what happens to houses that get foreclosed on, many of which were concentrated in communities of color, and that are taken back by the bank, but aren't yet put back on the market. And what we have found in our investigations is that the management and the marketing and the maintenance of those foreclosed homes that are vacant in communities of color is worlds different than in white communities, and worlds worse. So that they create, there are all kinds of conditions that really impact on people's health directly. You talk about those asthma triggers and other things, but also just the presence of a bunch of vacant homes in the neighborhood has a real impact on people's comfort level in getting out and about in that neighborhood and walking and, using the open space for healthy pursuits, right? And so we have used the Fair Housing Act as a tool to try and correct that problem. We filed cases against a number of individual banks and property management firms to try and get their practices changed, and the money that has come in through settlements in those cases has gone back into those communities to do all sorts of things to make the communities healthier places to live. So that's just one sort of big in some ways but small in other ways example of how the Fair Housing Act can really be a tool to help advance these goals. And so I really would encourage folks to get to know the fair housing groups that serve your area.
Yeah, if I can just add, in New Brunswick, so MBT is part of a bigger, we're focusing on housing overall, healthy housing being, a segment of that. We helped, fund a position here that's now the coordinator for the vacant properties ordinance that was passed, that we helped pass here in the city, and it speaks to that. That inventory is starting to come in. They're starting to go after properties where they've just left the property abandoned in bad condition, and at the very least trying to rectify those issues of blight that do affect housing.
Thank you. Thanks, everyone. So we want to make sure that we have some time to hear from you, our audience. So if you haven't already done so, please take a few moments and ask our panelists a question by typing them into the question box on the left side in the control panel. So I'll give a few seconds for you to submit some questions. So I'll start. There's a question, and I'm going to say this is geared toward Manny and Stephanie, is who are the community health ambassadors? Who are they in your community? How do you identify them, and where does the funding come from?
So I guess, go ahead.
Well, I can be brief. Manny's got a more elaborated program than we do. We recruited our outreach workers in one neighborhood, working primarily through the parent advocacy group at a school, a community school in that neighborhood, and in the second case, working through a community coalition, a kind of a neighborhood association. We also contacted all the early childhood centers to ask for their recommendations if they had any active parents or any staff that had part-time hours available. And the funding came from 3 local funders, and a Partners for Places grant that was a collaboration between our municipal sustainability office and some of the local funders. So it was a sort of a mix of sources, and the engagement was limited. It was a pilot, and so it's actually just drawing to its end right now. It was about a 9-month project.
So for us in New Brunswick, our ambassadors are for the Healthy Housing Project, specifically from the Esperanza and Unity Square neighborhoods. They're residents from the neighborhood, and they were identified through the neighborhood projects that are established, and were able to help us, refer people to us that they felt would be good residents to really push healthy housing forward. And the funding that we got to provide them stipends was built into our build grant. So we built in the stipends into our budget.
Great, thank you. We have about 2 minutes left, so I want to just ask for if you guys have any last comments. So we've talked about I don't want to say a fair amount about the Fair Housing Act. But thinking about your work in helping people have healthy homes, what do you think the state has accomplished toward housing equity, and where do we still need to improve? That was a loaded question.
I feel like I'm waiting for Debbie to weigh in on that, but we can
so was I, actually. I was going to bring it down local.
I'm the one person who's not in New Jersey.
Right. Or, have you seen change at the local level, or are we still, moving toward that?
So, I will say that I do think we've seen change. I think one really significant thing that we have, a tool that we have now that we didn't have 50 years ago, is the Fair Housing Act, right? So we do have a tool that is aimed at, eliminating discrimination in many, many different forms from the housing market, as well as now this, affirmatively furthering, some meat on the affirmatively furthering provision that tries to tackle the more systemic aspects of this and really to kind of topple the barriers that have been created by segregation, over many years. So I think those are really important vehicles that we've got to advance this work, and we need to be thinking about more and more creative ways to use them. I also am, as I said earlier, I take great heart in the fact that people are seeing these connections between where you live and all these other aspects of your life, and the opportunities available to you and the kind of path that you have available to you to really try and get to your fullest potential and live a healthy life, but also one that's productive and satisfying. And the fact that people are recognizing that we can't, just tackle these issues one at a time on separate paths, in different kind of schedules and, without looking at the kind of cross-cutting impacts, I think the fact that we're recognizing that is a really positive development. And the challenge that we have is how to move that forward. I did mention earlier that, and I know everybody on this call is very well aware of the limited resources that we have to do any piece of this work. That alone is a challenge, right, and likely to be one for some time to come. But it does make it so much more important that, that we do this work in collaboration so that we're really leveraging all the different pieces in the most potentially impactful way.
Thank you. Thanks, Debbie.
I would really just echo that, on a local level where, the fact that we're now addressing and looking at the social determinants of health as really, an important factors to impact health overall, healthy housing being one of them, is important and has served, I think, as a catalyst for a lot of this work. The fact that a lot of our partners here in New Brunswick have recognized healthy housing as an issue that we can all coalesce around and move forward. To your point, Debbie, the fact that you do need partners and I guess I'll say it again, the traditional partners and non-traditional partners to really get at the issue is important. On a local level, we're seeing that momentum. We haven't quite gotten there, but we've already started those conversations, like I said, with the city and the respective departments that can really help, affect and impact healthy housing overall.
Thank you. Thanks, Manny. So we are over time, so I do want to be respectful of everyone's time. On the screen, you see each of our presenters' contact information. I encourage you to reach out to them if you have further questions about their work, and I encourage you to look at their organization's websites and really follow the work that they're doing. So I want to thank each of the presenters, Debbie, Manny, and Stephanie, for sharing your perspectives today. And thank you to all of our attendees. As we mentioned at the beginning, a recording of the webinar will be available shortly. And you can find that on the New Jersey Health Initiative's website, which is on this screen. And you click on the News and Events page, and you'll find that recording there. So thank you, everybody.